Hey BIMS, it's Bryan here. We're going to take a few minutes to discuss hemorrhage control, habits, standards, performance in EMS. It's a quick review about the things we've gone over. I appreciate your time. Hopefully we get right to it.
And the lawyer time. I'm not your medical director. I'm not the state medical director. Nothing I say supersedes your medical director, your SOPs, your provider level or certification.
Hey team, let's try to hit HemCon in 30 seconds. Some pearls, right? So the pearls of hemorrhage control, pretty simple. Anatomy and physiology. If you know where the blood vessels are, you know where firm structures are adjacent to them. All it takes is pressure and a little bit of knowledge. So compress the artery to a bone or firm structure. Remember that interventions are simply replacing your hands and fingers. So you knew the anatomy, you knew the direct pressures route, you applied the basic foundations, elevation, pressure, direct pressure, pressure points, you stopped your bleeding. Now those interventions, you have to replace that exact physics, the exact pressure point using some type of intervention. And that's an art. And remember, we're doing this to create physiologic reserve. That's the CPR of trauma, right? So the more the blood and platelets stay in, the more reserve the person has. So not only do they make it alive to the trauma center, but they have a good outcome. Remember that pretty much everything we do in pre-hospital care is a stopgap measure. In other words, it's a bridge to definitive care. So time matters, right intervention, right time, given the overall arching clinical picture. And you have to know your materials. It's an art. Putting a pressure dressing on that works is an art, and we don't get to do that a lot. We don't get to see the outcome a lot in pre-hospital care and EMS, thankfully, because we just drive them to a trauma center, and that's great, but we're looking for best practice, right? And so understanding your material, understanding how to manipulate your material based on anatomy to replace that perfect pressure point you've put on, and packing and a good pressure dressing that doesn't decrease your ability to breathe or wrap around your neck or cause a tourniquet effect. These are critical, right? So basic pearls in order to create physiologic reserve: anatomy, physiology, pressure, and manipulation of material. I hope this helps. Out.